Hello, everyone. A very good evening to all of you. I am Salma Akhter, an occupational therapist working with special needs children about 9 years. So please let me know if you can see me clearly or can hear me clearly. Let me know, please. Okay, today we are going to talk about a very interesting topic, oral placement therapy, OPT, for kids with autism spectrum disorder. So first, we maximum people know about ASD. I just say a few words about this. ASD is a complex developmental conditioning involving persistent challenges with social communication, restricted or repetitive behavior. Uh, so, just give me a moment. According to DSM-5 criteria, for an autism diagnosis, children must have social communication difficulties and restrictive repetitive behavior and or sensory behaviors or interest. Children must have a certain number of autism signs and they must have signs from early childhood. So when we diagnose a child ASD, definitely parents will go to the therapist. So when they will go to the speech therapist, so speech therapist will assess their expressive language, their preverbal skills. So I want to say that not only looking for that, they should also look about their oral motor skills, feeding skills. So it's very connected. When a child has sensory issues, they have a feeding problem, they can be a speech clarity problem. So feeding issues, sensory issues, speech clarity, it's all are interconnected. You can't separate them. You have to work in each area. So what is oral placement therapy? Oral placement therapy is a speech therapy which utilizes a combination of auditory stimulation, visual stimulation, tactile stimulation to the mouth to improve speech clarity. OPT is an important addition to traditional speech treatment methods for clients with placement and movement deficits. It is a tactile proprioceptive feeding teaching technique which accompanies traditional therapy. So traditional therapy is primarily the auditory and visual. So next I'm talking about who do we work with. We can work, oral placement therapist can work with any client who displays oral motor difficulties as compared to their typically developing peers for feeding and speech, reduced mobility, reduced precision, reduced endurance, and also dysarthria, a weakness of feeding and speech. So, who do we not work with? We don't work with these people, client group, who can produce the targeted speech sound using auditory and visual cues with adequate mobility, precision, endurance. So we don't work with this client group. So now we will talk about how OPT helps or how it works. So clients with motor and sensory impairments benefit from tactile proprioceptive components because speech is a tactile proprioceptive act. So oral placement therapy is used to improve articulator awareness, placement, dissociation, grading, which is very important for speech clarity, stability, and muscle memory. All of these are necessary for development of speech clarity. So you have to know when you have to consult oral placement therapist. If your child has the oral sensory issues, if your child has issue with feeding, if your child have the speech clarity issues, so definitely you need to consult with an oral placement therapist. Okay, so goals of oral placement therapy for speech clarity and feeding. First goal, to increase the awareness of the oral mechanism, to normalize oral tactile sensitivity. As we know that kids with autism spectrum disorder may have sensory issues. A child can be hypersensitivity, hypersensitivity, or mixed type of sensory issues. So to improve the precision of volitional movement of oral structures for speech production, to improve differentiation of oral movements, dissociation, the separation of movement based on stability and adequate strength in one or more muscle group. So grading, this is very important. The control segmentation of movement through a space based upon dissociation. Fixing, an abnormal posture used to compensate for reduced stability which inhibits mobility. To improve feeding skills and nutritional intake, to improve speech sound production, to maximize intelligibility. So these are the goals for oral placement therapy for speech clarity and feeding. So next we will talk about therapeutic feeding. So if your child has the feeding issues, then you should know what is therapeutic feeding. So the goal of therapeutic feeding is providing adequate nutrition, the development of normalized oral motor functions for feeding, the development of normalized oral motor functions for speech. So as I said earlier, oral motor feeding, oral placement therapy, the speech clarity, these all are interconnected. You have to work with each areas. So therapeutic feeding, under therapeutic feeding, we do the spoon feeding, cup drinking, straw drinking, the solid food. So why the spoon feeding, cup drinking, straw drinking, solid food is important for speech or the feeding issues? It's very important because if your child can't, sometimes we can see that the child's mouth is open. They can't close the lips. So if you will use the spoon feeding, so how you will do that? So it's very important to understand the child's lackings or the child's need, which feeding therapy, which spoon feeding technique or placement we are going to use. For example, we can practice spoon feeding for lip closure. So your therapist will guide you about this. There are 3 placement of spoon feeding: lateral placement, frontal placement, and spoon slurp. So these are spoon feeding. So spoon feeding can help your child, the lip closure, tongue retraction, and also jaw grading. What is jaw grading? I will tell you later. And the next is cup drinking. So choosing a right cup is very important. Thickened liquids are easier for the child to control when learning a new muscle movement. As the skill level increases, the liquids can be thinned. So cup drinking can help your child also live closer. Tongue retraction, the tongue tip elevation for the sound is la, ra, this type of sound. So straw drinking. I'm practicing oral placement therapy about more than 4 years. So the parents who don't know about the oral placement therapy, they usually say that, oh, in oral placement therapy session, they usually do the horn blowing, the straw drinking. Actually, they don't know why we are doing this. What's our purpose? If they will know about the importance of this straw drinking and how it can help your child to achieve the skills for helping the speech clarity and feeding issues, they will definitely the value the therapy session. Obviously they do. So straw drinking can help your child for lip rounding, o for sound o, and the trunk retraction, jaw stability, and obviously independent self-feeding. So there are 8 straws in with hierarchy. I will show you later the straw, how it looks, and which kind of straw we use in therapy session. So last one is solid. Solid placement is very important because when a child learned about the swallow the purines, so when first you will try to teach them the solid food, they will try to swallow it. So definitely we don't want that. It's obviously life-threatening. So placement of solid food is very important, where we should place the food and what will be the size, in which shape of the solid food. There are cubes or julienne cut, which cut we should follow, what would be the size. So it's all are vary, child to child vary. So according to child's level, after assessing that, therapist will guide you that you have to use the cubes with 1.5 inch. So where you have to place, obviously the solid food start from this side, back molar or back molar ridge, the side to side. You shouldn't place the solid food front on the tongue, because if you will do that, the child will swallow the food. Okay. Next thing is feeding hierarchy. So when we will planning for the feeding intervention, so we should maintain the following points. Number 1, position. Position is very important because we don't want any compensatory movement. When we will teach the child how to chew the food, how to swallow the food, we don't want any compensatory movement. So position is very important. Position should be 90-degree knee, 90-degree feet grounded, midline of head, neutral flexion of head, and obviously the back support. So in sitting position. So second one is food choice or sensory diet. So children who with ASD definitely have sensory issues. So we have to first assess the sensory status, if the child is hypersensitivity or the child is hypersensitivity. So we have to understand that first. So if your child has hypersensitivity, he or she will prefer the highly flavored taste of food, crunchy or crispy texture, or cold temperature food. And usually the hypersensitivity child put a big size of bolus into their mouth at a time because they seek more sensory input into their mouth. That's why they do this. So if your child has hypersensitivity, he or she will prefer the blend food. So they blend food with smooth texture and the warm temperature. So identify the sensory status. Is the child is hypo, hyper, or the mixed type of sensory status, sensory. So it's very important. So according to the child's sensory status, we have to plan the feeding intervention. So one thing I would like to share, when you will work on the feeding program, so don't change the taste or texture at a time, because it's very difficult for the child to accept that. First, we have to change the texture and temperature gradually, and then we can go for texture until the child will achieve the motor skills. So next one is utensils. Utensils should be fit into their mouth, and it should be selected according to child's need. Placement of food, as I said earlier, the placement of food is very important, where you need to place the food. If you are feeding your child, if you are teaching your child how to swallow the puree, so where you need to put the puree, and if you are teaching your child how to bite the solid food, so where you should place it. So placement of food is very important, because if you place the food wrong, in a wrong way, so child will never achieve the skills, because it's a wrong way. That's why. Support, we need to provide support if the child needs. For example, the child has poor jaw stability, so we need to give support here during feeding time. So if need support, we have to provide that. Okay, now I'm going to show you some oral placement therapy tools, what we are using in our therapy session. Oral placement therapy tools all are from Talk Tools. So first of all, there are some sensory beanbag. There are 4 different types of textures: silky, bumpy, scratchy. So these are sensory beanbag. We have to use that. And first, let me remind you about this. Don't use any tools without assessing your child or without therapist supervision, please. Because in Google or nowadays online, we can get easily this type of tools. So first you have to understand which tool need your child and how it should be used. So without assessing your child or without therapist guideline or supervision, you can't use that. Okay, next one is tree tube. The yellow one, red one. Red one is easy, then yellow, purple, and green. There are 4 types of tree tube. Bite block. This can help for jaw grading exercise. Oh, maybe I missed one point. The jaw stability and the speech clarity. Actually, the our primary articulator for vowel production, first one is jaw, lips. Jaw is very important for speech clarity. Jaw stability. So I'm saying some I'm making some sounds. You just notice that: ma, pa, ba, a, ka, ga, wa, here. So you can see that for understanding this sound, we need to maintain the jaw position. So different jaw position, different height can produce different sound. So speech, for clear speech or sound, we have to maintain the jaw position and height. So this bite block can help. This is the spinner and toothpiece. It's a vibrator. So we have to first assess the child. If the child needs vibration, so we will use this spinner with toothpiece. And if they don't, so we can use only this toothpiece with different flavored. You can dip it into the juice or any liquids. This is Sensi. Sensi with it has different tape. It's for it's working for sensation. This is honeybee bottle. It helps the child for learning the first stage of straw drinking. Isn't it cute? Nice one. Yes. So this is the Talk Tools horn kit. It has hierarchy. So we have to assess the child first, then we have to select which horn. You can see there are 12 types of horn. So which horn we should be used and how many times, what are the our goals. So that's why I told you that you can't use this type of tools as you wish. You have to need therapist supervision. This is the Talk Tools straw kit. There are 8 types of straw with hierarchy as it will selected by child's need. And the last one is the Talk Tools tongue lateralization and elevation tools. It helps, these tools will help your child to elevate and lateralization of the tongue movement. So that's all. Well, we have lots of the therapeutic tools. You can find it on the Google. So now we are almost end of the discussion. I would like to say a few points as recommendation. So sometimes we can see that child's do this. So please don't press inside the tongue. Don't press in tongue inside, because when you will do that, it will come again. Never do this. Don't do this. Okay. So also don't press the tongue downward. Someone will say that during feeding time or spoon feeding time, you will put inside your mouth the spoon and then press down on the tongue. Please don't do this, because it will encourage your child to the tongue protrusion like this, and we don't want that. Sippy cup. Please don't use sippy cup. There are lots of therapeutic techniques for drinking, and there are lots of cup in the Talk Tools. So sippy cup, don't use that. It will also increase your child's tongue protrusion. Try to use mixed texture food, because if your child is hypersensitivity, so we want to teach our child that they will prefer all texture food. So from the beginning, you should use mixed type of texture. placement of food, I already said about that. Placement of food is very important. When you will start to teach your child the solid food, you should place back molar or back molar ridge, not here. It should be here, side to side, and this distance. And most importantly, don't use any tool without assessment and without your therapist guideline or supervision. So that's all from me. Actually, I wanted to let you know that about the importance of oral placement therapy, because most of parents doesn't know about that. They don't know about that. So I just wanted to let them why OPT should be used and how it will enhance your child's skills for feeding. And feeding is a very important part. Feeding and speech both are interconnected. You can't separate them. So that's all from me. If you have any queries, any comments, just write it in the comment box. I will try to respond to all of your queries, questions. So thank you so much. And please let me know from where you were watching me. I would love to know about that, in which country you are watching me. So, and also let me know if you want to know anything in further. We can make more more topic or anything we can do in our next session. So you want to know about anything, so please let me know. Thank you so much.